Hello all, I am Dr. Walter from SNS College of Physiotherapy, and now we are going to see another class regarding the filariasis. In the last video, we have seen about the leprosy caused by the bacteria, and this video is regarding a parasite infection which is commonly caused by the mosquitoes. So in this video, we are going to learn certain things in detail which causes this filariasis and what is the outcome, what is the drugs and all these things in this video. Going for the intro, this filariasis is a parasitic disease caused by the thread-like worms transmitted through the mosquito bites. So normally during the rainy seasons and all, there will be n number of stagnant waters present in our home and outside of the area. Now, in this places and all, we can see n number of mosquitoes which are dwelling among them. Okay, so what will happen if these mosquitoes, if they are transmitting these types of thread-like worms through the patients, to the persons, through the means of biting and through the means of transmission through blood. So this will cause the filariasis. Okay, so we are going to see in detail regarding the tropical and subtropical regions, and in India how many patients are affected and how many millions are getting affected onto the year. Introduction in detail. Lymphatic filariasis is commonly called as elephantiasis. Okay, it is also known as elephantiasis. Okay, now this is a debilitating neglected tropical disease. Okay, so normally what is neglecting? If this mosquito is biting some person, they will be neglecting. It is a small mosquito bite. So if they are neglecting like that, it may be a danger that it will cause the filariasis. Okay, now going for the next slide, epidemiological features. Okay, and global 86 millions have been affected. Okay, proportion of the global cases in India. So how many people are affected in India? That is 40%. Okay, so on global itself 86 million, and among that 40% will be carried out in India. Hope so it is a greater range other than comparing with other countries. Okay, now so unraveling the incubation. What is the incubation? The disease which are incubated inside the person body and the area and the duration of the development of the disease. First one, mosquito injects the L3 larvae during the blood meal. While they are while the mosquito is biting, it will inject the L3 larvae. Now, going for the second one, that is maturation. In this condition, maturation which will be happening inside and the bloodstream. Third one, microfilariae production. This adult worm will be producing millions of microfilariae inside the bloodstream, and this blood will be transmitted all over the body. And fourth one is the clinical onset, which will be occur years later. Okay, and it will also lead to the lymphatic damage. Now, going for the mode of transmission, it's divided into three types of mosquitoes: Culicine mosquito, Anopheles mosquitoes, and the Aedes mosquitoes. Now, going for the Culicine mosquitoes, primarily it is called as Culicid cunifasciatus. Okay, this is a common house mosquito. Anopheles mosquito, this is a species which transmit the filariasis, particularly in the rural areas. Aedes mosquitoes responsible for transmitting Brugia malayi in the specific foci. Okay, so these are the different types of mosquitoes which are spreading the disease. This is a common mosquito which we are seeing day to day life, and this is the thing, that is the second one. Anopheles mosquito is spreading the filariasis. Now, clinical manifestations. What will happen? Acute lymphanginitis, hydrocele, and elephantiasis, and also going for the lymphedema. All these things are cornering the lymphatic nodes and the lymph nodes. And if these are going for any type of issues, it will be a life threatening for the person. Now, investigation. How can we investigate? How can we diagnose that this is filariasis? How to relieve from them? And this is done by nocturnal blood smear. The first type of lab investigation. In this lab investigation, this will be connected at the night time when the parasites are more active. Okay, so the parasites are more active at the night, so this type of blood test will be conducted at the night time. Antigen detection test and the PCR based assays. So these types of tests to rule out the other findings. Treatment. Going for the last condition, there is a treatment. Annual single dose of diethyl carbamazine. This is the most important drug for the relieving the filariasis. And morbidity management, taking care of the chronic conditions like swelling of the leg, swelling of the lymph nodes. These types of care should be taken, and the vector control, reducing the mosquito population. That is to maintain the area clean and neat, to maintain the homes neat and tidy. So these are the most important thing which we need to rule out in this filariasis. Hope you understand this filariasis. Yes. So this is the most important question in the community medicine, and you need to write about the conditions which are most prevailing in India and also in the worldwide and the differentiation. Thank you.